Thank you so much for the riveting talk and the photos too, Dr. Shah. It just makes me realize how complex the challenges of fighting hunger is, but that it is doable. So we have about half an hour for Q&A. I think because we have one speaker, we take one question at a time instead of grouping them, sir. If you could introduce yourself before you ask the question.
Yeah, thank you. I'm John Coonrod with the Hunger Project. And thank you for this, Raj, and for all you have done for the country and the world. Given your theme of leadership, and one of the great things that President Obama did was that he really fully supported the Paris Principles and country ownership. And I'm just wondering how you saw the then integration of diplomacy into the health and agricultural initiatives during your tenure and subsequently, because the diplomatic, how U.S. leadership can influence country ownership, country leadership, country mobilization of resources.
Can I just stand here because I can't see
sure.
folks behind this big pillar. Excuse me. Well, thanks, John. And here's the reality. I mean, we did do a lot to embrace the Paris Principles and to fight for country ownership. Julie, I feel like you went to country after country after country to come back and assure me that, in fact, all these wonderful processes that we all worked on together, like the CADA process and others, were being followed and honored. And that's really, really important. There is a high-level political reality that getting country leaders to prioritize agriculture, it just sometimes requires going beyond the Paris Principles and saying, what's your top priority, and being persuasive, friendly, sometimes more aggressive about fighting for vulnerable populations inside of those countries. And one of the things that Mike and I talk about in the chapter that I mentioned and in the book is just my experience negotiating with the Pakistani leadership. A lot of the leaders there used to say, well, certain things like hunger and education and health are provincial issues. Here, we're the leaders of the country. We represent the federal level. So we'd like you to use the resources for things the federal government is responsible for. That there might be some technical truth to that, but to me, it's not okay for a country leader to say, girls going to school is a provincial issue, right? It has to be a leadership issue. So I think we should embrace country ownership. I think we should continue to do all the things you all are doing to make that real. But I also think we have to know that there are times when you just have to fight for what you believe in. And you have to be a little stronger than just being on the receiving end.
Thank you for your presentation. My name is Chen Qiu from IFPRI. So in the beginning of your talk, you talked about the hunger and malnutrition issue in the United States. So according to official data, about 15% of Americans are food insecure, and at the same time, more than half are overweight. I wonder if you could talk about what are the causes for the hunger and malnutrition in the United States, and what are the possible solutions to solve United States' own hunger and malnutrition problems. So, as you said, we need a healthier and more equitable food system here in the United States. Thank you.
Well, it's an excellent question. I think you guys have to come up with some of the answers here. Look, I think we actually know the basics of the answers. The basics are the relative price of cheap processed foods and fresh vegetables and more nutritious whole foods needs to change in this country. And by the way, that does not mean opening a Whole Foods that every time I walk into the place, I walk out with 2 bags and it costs $200. That's not what I'm talking about. You know better than anybody that our concept of what is healthy in this country is a sort of elite luxury concept that has very little actual scientific correlation to health and nutrition at population scale. So frankly, what I think it means is we need policies in American food that push more subsidy and incentive around things that we think of as nutritious, and mitigate the subsidy and incentive to things that we think of as the opposite of that. So that's one. The second is we have in place a food system and safety net that we need to optimize and take much more seriously. My wife ran one of the largest charter schools in Washington, D.C., about 12 miles. We live in Northwest D.C., about 12 minutes away. You drive 12 minutes from Northwest D.C., and you're in a school where 78% of the kids are getting a free lunch as part of the school lunch program, and where more than 65% of kids were getting breakfast there as well. Those are often the two best meals they're going to get that day, and we shouldn't be giving them excessive amounts of highly processed, high salt cheese that's been sitting around and needs to be sold. But we have to honor the fact that American producers and the supports for those American producers are the very basis of our food and nutrition safety net. So we can't be disparaging about their intentions, but we need a different system and a safety net that's driven by nutrition first and price supports and quantity management second. And then third, I actually think science has a lot to do with this. I think we need to see far more nutritious foods being produced by global food science and agricultural science. And I give a lot of credit to the Global Alliance for Improved Nutrition, as well as the bio-harvest effort to do biofortified foods. But those are relatively small investments compared to where the bulk of modern food science is. And I think that needs to be dramatically different.
Hi, my name is Ryan Lee. I'm a current graduate student in adult school in George Washington. Also, I have a degree in China Agricultural University, and the most of Chinese transgenesis food technology was developed by China Agricultural University scholars. But it's a very, very controversial problem, and a lot of Chinese public figures try to speak up against the transgenesis food. So do you think IFPRI or other agriculture scholars use the transgenesis food as a really important way to solve the world hunger problem?
Yes, I do think,
But how about the healthy problems? It's really controversial because you cannot say it's not.
Well, I'll just say that I've looked at the data I've seen. Well, Rob, why don't you answer the question? You're the expert. Come up here. Come here. Rob Bertram is the chief scientist and food expert at USAID. He's going to explain the data on the safety and effect and efficacy of transgenic foods. Rob.
Thank you, Raj, I think. No, thanks very much, and it's such a pleasure to be here. We at AID owe so much to this man, and so thank you very much for sharing your thoughts today. Well, I would just say to the questioner that there's no scientific evidence that suggests any health threat or any danger particularly associated with transgenic approaches as compared to any other kind of crop improvement. It's just one more tool in the toolbox. And I think the real question comes down to whether the world at this time, facing climate change, facing a 9 or 10 billion people, a population, can afford to turn its back on a whole area of science that's blooming as we speak. And when you think about it, when we make changes to crops and livestock through genetics, we're harnessing the basic energy of the sun coming in. I mean, this is a very sustainable approach. This is how humans have made their food, have ensured their food security for millennia. So this is one new approach. It needs to be done carefully. It can be done carefully, but there's nothing at the heart of it that really distinguishes it from other approaches. So we need to be smart about it and see how it can be used, and where it may have some advantages some places, in other cases other approaches may have advantages. So hope that helps.
That's my answer. You guys think of the next question. I'm going to look for the next answer.
Thank you, George Mihalis. I'm a member for UNESCO Task Force. And one of the issues we face, it's related to what we call intangible cultural heritage. How to take best practices, experiences like America has with US aid, and to disseminate them. We call it intangible cultural heritage, and specifically related to food or nutrition, agriculture, there's a lot of work to be done. You accumulated a lot of knowledge in America. How do you think you could, I know there are some temporary problems with UNESCO, but it's temporary, okay? How do you see America cooperating with UNESCO and others, document those best practices and disseminate them? One example is fertilizer. Impact of climate change and so on. Today, there are technologies available. America is the only country in the world which has the outreach, or to reach out everyone in the world with best practices, including possibly new technologies with strong, like game changer. Thank you.
Well, so questions about sharing best practices, and I would just note, I think, it's true the United States has a special role to play, in part because of the history of the American land-grant college system and the amount of science that was done and continues to be done in that system. I will also say we rely heavily on IFPRI, on FAO, on the big international, the CGIAR, to collect and share best practices that are not just American insights, but globally relevant insights from the world's smartest people in this space that Americans can learn from as much as Tanzanians. So those institutions are really, really important for sharing best practices. And I think, Shengen, you've done a great job with IFPRI. I'd like to see FAO be a stronger and more dynamic institution. I know Graziano's done a lot on areas like nutrition and brought his experience from Brazil, which was extraordinarily valuable and important, but FAO still, in my view, has opportunities to be better as a modern, rigorous, normative institution around the world. I just almost am completing a stint as an advisor to Ban Ki-moon on pandemic threat preparedness, and we have the same issue in health as I think you are articulating in food. And it's that sometimes our global normative agencies like WHO and FAO have not been invested in and have not grown successfully in the last several decades. And I think we have an opportunity to ask ourselves as a global community, can we do better? So I probably got in trouble with that one. So this is why I let other people answer the questions. But.
Hi, I'm Julie Howard, now at Michigan State University, but formerly at USAID with Raj. Raj, thank you for your leadership. I was telling Raj earlier that since I returned to Michigan State, my colleagues sort of look at me and say, you've changed. I'm not entirely sure that they mean that in a kind way, but anyway, they say, you're impatient now. My question, thank you very much for your leadership. I wanted you to reflect a little bit on the intersection of youth and technology and our food security and employment issues in the developing context. I'm asking that. I just recently returned from Rwanda, which is the most switched on African country I know. ICT, their youth ministry is called the Youth and ICT Ministry. But I went to the ICT Innovation Hub in Kigali, and I said, I want to talk to you about what work you're doing in the agriculture sector. And the manager said to me, why are you here? We don't do anything in agriculture. She goes, agriculture's got a huge image problem here. Young people don't want to go into agriculture. We think about all the opportunities to transform agricultural systems, not only here, but in developing countries, not only using ICT, but all kinds of spatial technology and processing technology and smart sensors. But somehow, even in a place like Rwanda, that message isn't getting through. I found it very, very scary. So just wanted your comment on that.
Well, Julie, I mean, you've done more on this than I have, and I would only know what you've told me. But I just think I think it's hard. I think we have to come to grips with the fact that a part of success in this sector is a percentage of the population moving out of food production into other areas of the economy. And in country after country where you still have, what percentage of total labor in Rwanda do you think is in food production? Okay, so if it's over half, you know, I don't know the answer to that question, but part of it is success should be more and more people moving out of that sector because that sector is much, much, much more productive. On young people in particular, I think it's science, technology, data, nutrition science, entrepreneurial food businesses. Those are the types of things I think are more attractive to younger people than core farming activities. I think that's true kind of all around the world. And so it was just here with colleagues, but people that are inventing new hydroponics. You're doing hydroponics here, right? Aquaponics, sorry. Others I've met over the holidays are doing hydroponic systems in different parts of the United States. And these young entrepreneurs that want to do like Silicon Valley type stuff and apply it to food systems. And I think we should have more opportunities for that. That's why I'm excited about the U.S. Global Development Lab at USAID to provide kind of entrepreneurial seed capital to people that want to try to do those things.
Hi, we have an online question from Asma Latif, Director of Bread for the World Institute, who would like to know what you want to hear President Obama say about ending hunger and malnutrition and the SDGs in his final State of the Union.
Oh, that's easy. That's easy. I'm very practical now. I just want him to tell the Congress on a bipartisan basis, pass food aid reform, pass Feed the Future. You said you would do it. You came close. You have an opportunity to get it done. Get it done. I'm sorry, you.
Sorry, we'll take questions here and then.
Yeah, Larry Schaefer with Schaefer Global and Genesis Agronomics, the aquaponics. So you opened the door with the healthcare thing in the pandemic situation. The most recent situation with the Ebola crisis, and we start looking at the analytics behind that and what happened with that situation and what changed, because for generations they've been living with Ebola. And so we had to look at what changed. Did Ebola change or did the people change? So it really gets down to nutrition because it affected the urban areas. It didn't really affect that much in the rural areas. So how can we associate funding for proactive healthcare versus reactive healthcare to fund some of these agricultural projects to address nutrition?
Well, let me just say on Ebola, I think this epidemic that played out largely in Monrovia and then spreading was for a variety of reasons very differentiated from the smaller rural DRC-based outbreaks that are our mental model of what an Ebola outbreak is. And so without getting into truly answering the first part of your question, I think it's quite multifaceted but well documented that this is very different. Second, I think there's a simple answer to the question, a complex one. The simple one is we don't do a good job as a global community of visualizing vulnerability. We should be able to sit in a room and see on a screen. Shengen, you should have this somewhere in the building. The next time I come here, I should be able to walk into a room, sit with you, and you have like a virtual world map that shows you real-time hunger. Why don't we have that? I'll bet you, I'm making this stuff up now, but I'll bet you that if you took 800 million people that are chronically hungry, a very high percentage probably have access to sending SMS texts, right? So I don't know the answer, but we should get out of the business of these kind of interpretive models that model and project and use assumptions that we invent and model and project again over and over, and get into the business of real-time data visualization because of a couple of things. One is I think it will help change the consciousness of what we should be doing about it. It's one thing to say there are 795 million people that are hungry that are out there somewhere, and on a country-by-country basis we can show you the numbers. but on a map we can't tell you who. That was, by the way, why Ebola, the early response was so weak, to be honest. It wasn't until mid-November that people were actually looking at a map and saying, that's an Ebola case, let's go get it. They were looking at interpretive model data saying so many cases are probable, likely, suspected. And it was kind of nonsense from a response perspective. So that's one thing. The second is, I just think we have to do more to embrace and fight for political leadership in this space. And we have to look. In the time that I ran USAID, we had sequestration, we had a massive shift in our national politics in 2010 that are having generational consequences in American politics. And we had a period of discord in bipartisan action that is roundly considered unique even by the low standards of congressional history. But in that context, we had a 60% increase in the size of our, we had a full doubling of the size of our foreign service. We had a significant increase in our budgets year after year. Only USAID and NASA were the only two agencies that got budget increases during sequestration. We rebuilt our procurement capabilities and really were able to launch a series of new programs, including Feed the Future and the U.S. Global Development Lab, that people would have said you should not do during a time of sequester. And we were able to do that because we got people together politically to lead on our behalf. So I just think the politics matters a lot in this fight.
I'm with the newsletter called AgriPulse. Could you talk a little bit more about the problems involved in changing the food aid delivery system, getting away from just massive shipments of corn and wheat overseas to maybe monetizing it a bit?
Well, first I think we have to recognize and honor the gains that have been achieved. So I'm very grateful to Debbie Stabenow and the agricultural committees for passing a farm bill that effectively, dramatically reduced, in my view, effectively ended monetization as a practice, where we take American food, ship it, drive it into places, and then sell it in those local markets, which is not the best thing if you're a local farm producer. So that was a big step forward. She took from 13 to 20% the amount of flexibility in the overall program to be cash and voucher and call it medically science-based as opposed to commodity-based. And as a percentage shift, that's a 50% increase. I'd like to see that number be 40% or 50%. So I think there's a lot of progress that still has to be made. And through tough times, both the Foreign Affairs and the Agricultural Committees strongly supported our fight against hunger and our increased investments in agriculture. So those are the gains. Where would you like to see progress? You'd like to see the 20 go to 40 or 50. I think that would be transformational for the global humanitarian fight. You'd like to see the numbers continue to go up even in tough times. That, I think, is quite achievable. You'd like to see far more nutrition science embedded in food security responses, because it is the case now. If you look at the excess mortality rate of children during famines 20 years ago versus today, it's really night and day. I don't have the statistics with me, but Nancy Limborg, who now runs the Institute of Peace, would often talk through the effectiveness of modern humanitarian effort compared to previously. And the things that drive that effectiveness are more health interventions for hungry children. It's actually those health interventions that save lives more so than commodity food. And then really targeted, observed, and intensive feeding for resuscitation, often with specialized medical foods or ready-to-eat therapeutic foods, whatever you want to call them. So I'd like to see a science-based, flexible approach, and I think we have a long ways to go.
My name is Amy Kokenauer. I'm with NCBA CLUSA. Thanks so much for your very articulate voice and leadership on these issues. I now that you've been out of office, you've had some perspective on things. My question was basically, looking back at your time at USAID, is there something that you would have done differently? There's something you wish you had done, you couldn't do, or just what would that be?
Well, the biggest thing, first, thank you for the comments. The biggest thing I wish I had done was just engage more effectively with Congress earlier and build those kind of sustainable bipartisan relationships from day one. And, we didn't really embark on that as a real focus of effort and activity until maybe a year and a half in. And I feel like we missed a year and a half of being able to do some extraordinary things. The lesson for me is that the next leadership should do that work. And, President Bush did it himself and with his White House team on behalf of PEPFAR and PMI. President Obama did a lot of supportive effort, but also empowered his Secretary of State and myself to lead those efforts a little more. It doesn't matter how it gets done, but the politics of development and of foreign affairs and this global fight against hunger and poverty is important, and we need leaders in the space that are willing to do that political work from day one.
My name is Dan Silverstein. I'm a private sector and capital markets advisor. I was a consultant at USAID in the Bureau for Food Security, and I went there because of you.
Thank you.
You're welcome. I have a question for you, but before I ask it, I want to make a comment. Of all the things that you said here today, perhaps the most profound for me was your comment about the 360-degree screen with real-time data. My friend David Lambert used to talk all the time about putting a human face on hunger. And if he were able to be here today, I think he would have been very excited about the concept of what you said. So thank you for saying that. I'm doing a research report on the role of the private sector during the years of the Obama administration in food security. And one of the areas that I've looked at is the New Alliance. And as you know very well, there's a great deal of criticism early on. The comments that I'm finding are from 2013 and 2014. And it occurred to me as I was reading them that they were all projecting that bad things were going to happen. So my question to you is, did those bad things happen? and has the whole concept of the New Alliance been able to drill down to at or near the base of the pyramid? And contained within that question is this inherent question of, can USAID drill down deep enough to get to the poorest of the poor? Or is the approach really more effective if you're looking at commercialization for food security? Thanks.
Well, thank you for the full range of comments there. On the question specifically, this New Alliance for Food Security and Nutrition, which we launched around the G8 in 2012? 2012. And you're right, it led to a strong critique from those who worried about private investment in agriculture. My assessment is probably not all of the commitments were met, but many, many more of the commitments were met than I would have expected, both from governments who made policy commitments and then stuck to their implementation, and from companies that made investment commitments and stuck to those commitments. I'd say progress was slower than we would have hoped, but the movement that effort created, now I think embodied in an enterprise called Grow Africa, is I think just a natural movement that is about companies and governments talking to each other and figuring out how everyone can participate in the revitalization and modernization of food production in country after country. So, I'd say I don't think the bad, harmful things about private investors in agriculture hurt people. If anything, the critique would be it didn't move fast enough. because countries were slow in implementing their reforms, and companies were slow in, after they said, okay, I'll invest $500 million in African agriculture, making those first $5 to $10 million investments proved to be harder than their initial CEO commitments. But it's more errors of omission than conduct. How are we doing?
I think
We are? Okay, thank you all very much.